Pneumonia, a global health threat, especially for the young and old. Pneumonia, a silent killer. Did you know that pneumonia is a deadly infection that often goes unnoticed until it's too late? This World Pneumonia Day, let's shed light on this life-threatening condition and explore how we can protect the most vulnerable among us. Pneumonia is a severe respiratory infection with symptoms like persistent coughing, rapid breathing, fever, and loss of appetite. Left untreated, it can lead to death. This disease is a significant global health concern, taking millions of lives annually. In 2021 alone, it claimed 2.18 million lives, according to the Institute for Health Metrics and Evaluation. China is no exception, with a pneumonia mortality rate of 12.7 per 100,000 people. The young and elderly, most at risk. But here's where it gets concerning. Pneumonia is the leading cause of death among children under 5 worldwide, according to the World Health Organization. It also poses a grave threat to older adults and those with chronic illnesses, especially in low- and middle-income countries. This is largely due to the natural decline in immunity as we age, leaving the elderly more susceptible to infections. Older adults often experience a general weakening of their organs, including the respiratory system, which becomes less efficient at defending against pathogens. Common issues like dental problems or poor appetite can lead to malnutrition, further weakening their immune system. But it's not just the elderly who are at risk. Children's vulnerability. Children's immune systems are still developing, leaving them more vulnerable to various infections. Their immune function doesn't reach adult levels until around age 6. Anatomically, their airways are narrower, and their respiratory system is more delicate, making it harder to fight off microbes. When combined with crowded environments like schools, where exposure to germs is high, children become prime targets for lung infections. Malnutrition and anemia further increase the risk of severe pneumonia. Uncovering the causes. Pneumonia can be caused by bacteria, viruses, or fungi. The most common type is pneumococcal pneumonia, triggered by Streptococcus pneumoniae, which can infect people with weakened immunity due to colds, fatigue, chronic bronchitis, heart disease, or long-term smoking. A telltale sign of pneumococcal pneumonia is coughing up phlegm with blood streaks, explains Dr. Qin Cheng, a respiratory specialist. Viral pneumonias are also on the rise, with viruses causing 39.2% of adult pneumonia cases in a 2019 China-wide study. Common viruses include influenza, RSV, and adenovirus. RSV is highly contagious and a leading cause of hospitalization for infants and young children with lower respiratory infections. It spreads easily and initially mimics a common cold. But here's the twist: treatment depends on the specific cause. Treatment and prevention strategies. For viral pneumonia, antiviral drugs are often ineffective, so treatment focuses on monitoring complications. Mycoplasma pneumonia, however, responds to targeted antibiotics, while pneumococcal pneumonia is typically treated with antibiotics like amoxicillin. Prevention is crucial for at-risk groups. Simple measures like regular ventilation, frequent handwashing, and avoiding touching the face with unwashed hands can help. Staying hydrated and engaging in physical activities boost immunity. A balanced diet rich in protein, vitamins, and minerals is essential, especially for children and the elderly. Vaccination against pneumococcal disease and influenza is recommended for children over 6 months and adults over 65. Limiting visits to crowded, poorly ventilated places is also advised. And remember, stress management is vital, as stress can weaken the immune system. Controversy and comment. Is the focus on pneumonia prevention enough, or should we also prioritize early detection and treatment? Share your thoughts below.